So, as most of you know, October is Breast Cancer Awareness Month. And today I'll be interviewing a good friend of mine. We've known each other since college, Natalie Finn, who lives in New Orleans. We both went to LSU, go Tigers. And she's here today to generously share her experience, battle, fight with breast cancer. So, Natalie, thank you for joining.
Yeah, absolutely. I'm happy to be here.
Awesome. Well, yeah, and look, I'm really appreciative of you being willing to share your story. There's a lot of people out there that, I think that would benefit from general awareness of breast cancer and just kind of hearing your story. But I think it would be helpful to hear a little bit about you and just like who you are, where you're from, what you do. Obviously, your profession is a bit relevant here as well. But yeah, I would love to hear a little bit more about you.
Yeah, absolutely. So I'm Natalie, like Billy said. We go back to about the age of 18 at LSU. I am 36 years old, and I was diagnosed with breast cancer in January of 2020. I am technically still a newlywed. I got married to a great man in 2018. We have no kids, but we do have a chocolate lab. That's our baby. Um, for my profession, like Billy was saying, it's kind of ironic, but I'm a women's health nurse practitioner. So I do a lot of breast exams and breast screenings and, ordering mammograms. I've been doing that for about 5 years now in New Orleans. And 2020 has been a roller coaster.
Wow, I bet. And perhaps you could tell us a little bit about just how you discovered that you had breast cancer. I know you work in women's health, and so maybe this is something you thought about, but I'll ask the obvious question: how did you discover it?
No, that's a great question. I actually discovered it myself. Kind of, what I always tell my patients, I think a lot of people are intimidated by doing self breast exams because they don't know what they're feeling for. They don't know what is considered abnormal, and what I tell them. And I kind of, listen to my own words is, know what is normal. And so I would never do an actual breast exam, but I would feel my breast and I knew what was my normal. And I actually felt a lump in my right breast just doing, honestly, just putting lotion on after a shower. It was very small. It was painless. And I just kind of took note that was odd. I had never felt that before. And I just moved on, with my day, not really thinking too much of it. Once again, what I tell my patients is, if you feel something new, whether it's a lump or skin change, a nipple change, watch it, and if it goes away, then that's just kind of your normal fluctuations, in hormones. This was not going away. I probably first felt it in November of 2020 and kind of just watched it. It never changed in size, but just the fact that it was still there kind of was just in the back of my mind. So finally, New Year's came. I was trying to have a baby, and I just thought, you know what? Let me just go get an ultrasound. I just want to start off 2020 fresh and, to basically get some reassurance. And I was shocked and basically told that I had triple negative breast cancer right after my imaging. They didn't even need to do a biopsy. The radiologist was that convinced. So it happened all pretty fast.
And what does that mean? I'm sure that came as a shock, but I feel like that for a lot of us, that's like, medical terminology on the triple negative, or however you phrased it. What exactly is the triple thing that you mentioned?
Yeah, so there are two basically types of breast cancers can be broken down into two categories, one that is hormonal and one that is non-hormonal. So the non-hormonal is called triple negative breast cancer. It tends to be the more aggressive breast cancer and is usually found in older women. So it's definitely kind of a little unusual, and a 30-something-year-old that has zero family history of breast cancer. the hormonal breast cancers, you tend to see a lot more in younger women, not always, but they're basically estrogen and progesterone dependent. And so while they can still be serious, there's a lot more types of treatments available, because they are hormonal dependent. With triple negative, you typically, they're more aggressive, and your treatments, as far as like oral medications and long-term therapy, it is a little bit more limited in the triple negative.
Okay. And let's pause there, because that's like a, I can't imagine being hit with that news, right? You're prioritizing, and I guess like to timetable this out, you felt a lump in November of 19, 2020 starting, you go get an exam, and boom, you're hit with this crazy, shocking news. Like, what was going through your head at that point?
I actually went down for an ultrasound where I work at Ochsner, and I honestly just showed up to work a few minutes early to go get this ultrasound. I had a full day of clinic with patients, fully expecting just to go in and be told that it was a cyst. So I was by myself when I was told I had cancer. So I think just the shock of, this doesn't feel real, versus, oh my God, how am I going to tell my husband? How am I going to tell my family? It was kind of surreal. I didn't immediately start crying like you might think you would. It was almost, it didn't feel real, because I'm healthy, I'm physically fit, I'm active. I felt fine. I did not feel sick. So to be told that you have cancer, and that potentially it's been there, for who knows how long, it just doesn't, it feels surreal.
Yeah. Wow. So that's a lot that you were processing, right? And so I'm putting myself in your headspace, and I'm just like, okay, what would I actually be thinking? What would I be thinking at that time? And I'm imagining this through your lens, and I'm just like, okay, what's next, right? I go into like functional, like how do I manage this, right? And triage and treat and everything. But I'm sure there's a lot of emotion baked into that, and talking to people, but you're also, a health practitioner in the nursing world. So it's like, what were your next steps from there once you found out?
Yeah. So, I mean, I knew, even though the radiologist told me that, she knew this was cancer, I knew that the next step was, you have to do a biopsy. You have to have a procedure where they basically take a sample from the mass, and it's going to tell you exactly what type of cancer and kind of what we're dealing with. So I knew that that was the next step. I was very, very fortunate that I basically got my biopsy immediately. They squeezed me in, and I had a biopsy within the hour of first knowing that I pretty much did have cancer. And that is nice, but it's also, I don't want to say it's unfair, but not everybody gets that treatment. And then, when you do the biopsy, it's a lot of waiting. The average turnaround to actually have your biopsy report, I mean, can be anywhere from 7 to 10, even 14 days. I was very lucky in the sense that I, had some connections and knew some pathologists, essentially, who sped that up, and I got my results like within the same week. So
Wow.
the anxiety that I felt, and it was expedited, no one should have to go through that. But I realized that I was very lucky in the sense that no one gets imaging, a diagnosis, a biopsy result as fast as I did. It's a lot of times a very drawn out process to even know exactly what you're dealing with.
Yeah. Wow. I bet. Yeah. Okay. So thinking through that process, and obviously, you work with these people, so you've got connections, and you've got the expedited version of the process. How soon did you go into treatment, and what was treatment like?
9th, I got my biopsy done. And on February 9th, I was having surgery. So pretty fast. I had a double mastectomy with breast reconstruction all on this same day. Then in March, I went through an egg retrieval to essentially preserve my fertility and to hopefully be able to have children one day. Then chemo started in April. I did essentially 4 months of chemo, had a little bit of a break in the summer, about 6 weeks, and then I started 28 rounds of radiation, and my last day of radiation was on August 20th. So I'm officially done with treatment. I still have a lot of follow-ups, but that was, I feel pretty lucky because not everyone's treatment, even though was about 9 months, that it can be a lot longer.
Wow. Yeah. I mean, you said 28 rounds, and I'm just thinking, I've never been through radiation, but I've heard and I've seen how it just batters people as it's going after the cancer, of course. But I guess what's the range in treatment from like the low end of a level of radiation and chemo to like the maximum? Is there kind of a general range for reference?
Mm-hmm. So, when you get breast cancer, the treatment kind of depending on the size of the mass, what type of breast cancer, the stage, mine was caught very, very early. So technically mine was stage 1. It had not spread to the lymph nodes or anywhere else in the body. So I was very, very lucky. But going back to the type of cancer, because mine was the more aggressive type, I really required chemo and radiation. Some people can, I don't want to say get away with, but sometimes it's appropriate just to do what's called a lumpectomy, where you would just actually remove the lump in your breast. You would not have to remove like the full breast tissue or do any of that. It's a lot. It's an outpatient procedure usually. The mastectomy is sometimes can be a personal choice, but sometimes it's also required. The mastectomy is when they actually remove all of your breast tissue. They usually remove at least one lymph node, and sometimes they actually remove the nipple. I definitely needed at least the right breast mastectomy, but I chose to go ahead and just do a preventative, like a double, just because I don't want to go through this again. So in my mind, that was definitely the right decision. It's not the right decision for everybody. Same thing goes with chemo and radiation. Not everyone, some people, when they do the lumpectomy, they only need radiation. For me, I needed chemo, and radiation was kind of, I don't want to say just my choice. It was recommended, but there were definitely varying recommendations as far as radiation goes, depending on the type of cancer. I do not regret doing radiation because in my mind, you want to, if there are any cancer cells left in your body, you want to do everything that you possibly can to, to just completely burn those cancer cells and hopefully never have it come back.
Yeah, I can imagine. You just want to be done with it and get rid of it, right?
Right. And move on, hopefully, with your life.
Yeah. Yeah. Okay. And one other question on treatment, like, I'm sure that impacted just your appetite and diet and whatnot. Did nutrition play a role through any of the treatment or even after treatment?
Yeah. So I think what a lot of people don't know, myself included, is that, you get a cancer diagnosis, and then of course, not to make light of anything, but you have to sometimes make jokes. You always think, oh, well, maybe I'll lose a few pounds. With breast cancer, it's actually the opposite. A lot of breast cancer patients actually gain weight. So different chemo is different for everyone, but at least with the drugs for breast cancer, a lot of the times nausea and vomiting is really well controlled. I actually never had nausea. I never vomited once. But the weight gain kind of comes because you're so fatigued from chemo. A lot of people aren't working out. they're not eating as healthy maybe as they should because they just don't have the energy or maybe the access to, eat like they normally would. I was very lucky in a sense, and I kind of always tell my gym that I go to, I was probably the fittest physically I ever was when I got my diagnosis, which is kind of ironic. I was working out 4 to 5 times a week. I was great. And I do think that there's definitely a correlation to how healthy I was going into the surgery. And I don't want to say this was not a breeze by any means, but I handled this very, very well. I felt like my recovery was relatively, uncomplicated. And so, yeah, I do think nutrition, even through chemo and radiation, you have to eat well. And when you can, I definitely couldn't work out like I did pre, my cancer diagnosis, but I made it a point to still work out on my good days and to still, try to be as healthy as possible because, your body is healing and it is going through a lot. So I definitely think nutrition before and after, it plays a huge role. There's no doubt.
Yeah. Okay. Well, let's talk about today. Like, what's life like today? Post-treatment and what's the prognosis going forward?
Yeah, so I have been technically done with my radiation and my treatments since August 20th, so about 2 months. So, as you can see, my hair is growing back. I'm about 4 months out of chemo. So you can tell that your body's healing. I lost my eyebrows, my eyelashes, everything. And it's amazing to see how your body bounces back. So I feel really good. I would pretty much say that my energy level and everything is back to normal. I'm working out. I have a normal clinic day at work. I definitely still, energy level when I try to run and things like that. I'm not quite where I was, before all of this, but I feel pretty good. Usually once you're kind of in remission, so to speak, you definitely still have doctor's appointments, have an oncologist appointment in about 2 weeks. For me, that's probably going to be every 6 months with my oncologist and my radiation oncologist. You're going to be seeing them at least once a year for a very long time.
Mm-hmm. Yeah, that was my other question is like, do you just go once a year indefinitely, or how long do you do checkups, or do you suggest kind of like keeping an eye on that?
Yeah, so that was a big question. Is it's kind of like, well, what now? You're constantly worried about reoccurrence, and honestly, the answers I get, it's pretty vague. You just have to listen to your body. Obviously, I don't have any breast tissue, so I'm not going to be getting mammograms, but you definitely still want to feel your breasts, because there could be a lump that I could feel, depending on how and where it came back. Also, just little things, for example, if I have a headache and I have a headache for 5 days and it's not stopping, or just anything that's persisting beyond just your normal aches and pains, I've been told to go in. So if I'm having, back pain and it's, unrelated to anything that I normally have, or anything that's just persisting, they can be really vague symptoms, unfortunately. So a lot of times when it does come back, it's not always good, because a lot of times it's, a lot further on and sometimes has moved on to other areas of your body to where, it's not always a lump you're going to feel. It can be a lot more vague symptoms that you might tend to ignore.
Yeah. Okay. Well, those are good tips. And speaking of tips, what advice do you have for anybody watching this?
Gosh, it is, I cannot say this enough, is just, I don't even want to just say breast awareness, but body awareness. You always say that, but until, you are your best advocate. You know your body and you know when something is not right. I have excellent doctors, but I actually did have a doctor feel the lump, and they kind of, oh, it's probably nothing, just wait a few more weeks and then it'll probably go away. Not saying that that's the wrong advice, but if I would not have, brought it up again and said, hey, please order me an ultrasound, things could be a lot worse. So anything new that's not going away, anything that is abnormal for you, and is, staying, whether it's changing or just still there, you have got to bring it up and force for imaging. I quite honestly, even if your insurance won't pay for it, I would rather pay a couple $100s out of pocket to have that reassurance than putting it on the back burner. And then, breast cancer, there's a lot of success stories and there's a lot of unsuccessful stories and a lot of really sad stories that maybe if that patient would have spoken up, or if they had gone to a different provider and had gotten that imaging, that, their story might be a lot different.
Wow. Well, that is a lot. Thank you for sharing this story. I think that I know that this will be helpful for countless people that see this, and I'm sure that you've told this story to close friends and family members over and over again. So hopefully this maybe even saves you a few storytelling sessions, right? But honestly, Nat, I really sincerely appreciate you taking the time to share this very personal journey, because I'm confident, and you in the medical field, I'm sure you're confident too, that this will help some people. And if this saves someone's life or gets them into treatment faster, then it's totally worth it,
Absolutely.